Then comes inherited bone marrow failure syndromes, much important topic. So inherited bone marrow failure syndromes can be of lot of varieties, but for exam point of view, you have to be having crisp and concise text on the inherited bone marrow failure syndromes. Most common is Fanconi. Fanconi is autosomal recessive inheritance, except for FANB. Only FANB is X-linked recessive. And remember, order of commonest Fanconi genes. Fan K is more common than Fan C. Fan C is more common than Fan G. Then it's more common than Fan D1, also called as BRCA1. Fan D2. So Fan K is common, Fan C, Fan G, and Fan D2. Fan D2 is also called as BRCA1 mutations. And then Shwachman-Diamond syndrome, as we all know, is characterized by hallmark of 7q abnormality, isochromosome 7q. And then dyskeratosis congenita, autosomal dominant, recessive, X-linked. All three are possible with 30% in incidence. 30% dominant, 30% recessive, 30% X-linked. So what are all the genes commonly involved in dyskeratosis congenita? DKC, TERT, and then NOP10, NPH2, TINF2, all are genes involved in dyskeratosis congenita because the problem is telomere biology. What are telomeres? Telomeres are the end region of the chromosome, which helps during DNA replication, chromosome shortens. So this telomerase enzyme help in lengthening of the chromosome. When telomerase is deficient, during each replication, if chromosome shortens, it go for apoptosis. That's why patient gets pancytopenia in telomere disease biology. Other syndromes are congenital amegakaryocytic thrombocytopenia, mutation in MTL or thrombopoietin receptor. And then we have Diamond-Blackfan anemia, which is characterized by these two mutations, RPS19 or RPL5. Nothing but ribosomal pathies. Diamond-Blackfan anemia, MDS5Q, Shwachman-Diamond syndrome, and Pearson syndrome. All these four are Diamond-Blackfan anemia, myelodysplastic syndrome 5Q, Shwachman-Diamond syndrome, all these are ribosomopathies. This can come in exams. All the following are ribosomal biogenesis disorder except. So except will be another option. So Diamond-Blackfan anemia, myelodysplastic syndrome 5Q, Shwachman-Diamond syndrome are all ribosomal disorders. And then we have congenital dyserythropoietic anemia, which we have discussed previously. And then predominant neutropenia, remember Kosman syndrome and cyclical neutropenia and DIM syndrome. DIM syndrome, cyclical neutropenia, Kosman syndrome, all are autosomal dominant inheritance. Diamond-Blackfan anemia, autosomal dominant inheritance. Remaining all bone marrow failures are commonly autosomal recessive in inheritance. So predominant thrombocytopenia, remember this TAR syndrome. And then sometimes we get this syndrome also. MYH9 related abnormalities, which are very ugly. They come with Pelger anomalies with bilobed shaped neutrophils along with deafness, sensorineural hearing loss, early onset nephropathy characterized by hypertension, proteinuria, and CKD. So when patients with bilobed neutrophils coming with mild thrombocytopenia, deafness, and renal damage, think of MYH related abnormalities.